Today, in this session, we are going to focus on proximal approaches of the sciatic nerve block. So first, I have no conflict of interest. Anatomy pictures adapted from the Elsewhere Complete Anatomy app 8.0 and appropriate patient consent has been taken. Before going to the techniques of blocking the sacral plexus or sciatic nerve, first we'll revise a bit of anatomy for better understanding. So first, the sacral plexus, it is formed by the first three sacral nerves and the fourth and fifth of the lumbar nerves, which also get branches from the ascending division of the fourth sacral nerves. Located on the anterior surface of the sacrum, separated by the piriformis muscles. It is covered by the parietal portion of the pelvic fascia, and in front of it lies the ureter pelvic organ part of the. As you see in this cross section of the pelvis, the bony landmarks sacrum and ilium. You can see the bony landmarks sacrum and ilium. Then you see the sacral plexus coming out of the pelvis, going into the gluteal region under the piriformis muscle and the gluteus maximus muscles. Then you also see the various major organs in the pelvis in close proximity to the sacral plexus, like rectum, internal iliac vessels, colon. As you go further down caudally, you will see that again bony landmarks of ischium and sacrum, and the nerve is sacral plexus is coming out. So as you come caudally, you will see that sacral plexus is coming out of the greater sciatic foramen under the surface of piriformis and lying directly under the gluteus maximus, and along with the superior and inferior gluteal vessels. Now we'll see the coronal section for better understanding. This we see the gluteus maximus muscles. If we retract this gluteus maximus muscle, we'll see under the piriformis muscle, and under the piriformis we are seeing the sacral plexus coming out of the greater sciatic foramen along with the superior and inferior gluteal vessels and nerves. When you remove the piriformis, we'll see that the sciatic nerve is lying over the superior gemella, inferior gemella and the quadratus femoris muscle and going into the subgluteal region. This is the bony landmark for the sacral plexus, which we should know before performing the block. So this is ilium, this is posterior superior iliac spine, this is ischium, this is the greater ischial tuberosity, and this is the greater sciatic foramen from where the sciatic nerve is coming out. So what are the branches of the sacral plexus? The main branches is the sciatic nerve, which consists of tibial nerve and the common fibular nerve. Other branches supplies the pelvic girdle and the perineum. So the main other collateral branches are anteriorly and posterior branches. Anterior branches are quadratus femoris, now to operator internus, pudendal nerve, now to levator ani. While posteriorly it gives branches superior gluteal nerve, now to piriformis, inferior gluteal nerve, posterior and perforating cutaneous branches to the hip and pelvic splanchnic nerve. So if you see in this image, you will see the dermatome, osteotome and myotome. If you see dermatome, sacral plexus supplies the whole lower limb from the hip area to posterior part of the thigh and below the knee, except on the medial surface, medial side, which is supplied by the saphenous nerve. In osteotomal, you can see all from the ilium, ischium till posterior part of the femur and all the bones below the knee supplied by the sacral plexus. If you come to muscular sensory distribution, you see that whole of the hip area, posterior part of the thigh muscles and all muscles below the knee are supplied by the sacral plexus.